Overall, they saw that there was a decline. One good part that they found out was that the racial disparity, earlier there was a higher trend seen in kids who were non-Hispanic blacks, and that trend they saw decline. So the gap between the whites and black in the prevalence of asthma is decreasing, but poverty continues to be a major risk factor for asthma prevalence. So kids who are in poverty, they try to stratify them into near poor, poor, or non-poor. The kids who were in the poor category had steady trends or slightly increasing prevalence of asthma as compared to kids who were in the non-poor category. We do think environmental exposures are important risk factors. Obesity is an important risk factor. Kids growing up in poverty is a risk factor, both in terms of diet, hygiene, and environmental pollution, as well as obesity. So we do think those are risk factors, but we as such do not understand the underlying etiology for asthma. So as exposures to these risk factors has leveled off, the incidence seems to have, the prevalence seems to have plateaued over time. But I do think the effect of stress and environmental exposure, especially kids living in poverty, have much higher incidence of exposure to tobacco smoke, which seems to be less of an issue in the higher income bracket families. So those environmental exposures may be contributing to increasing or steady prevalence of asthma in the poorer segments of our society.